Texas health officials say that this is the week people who came in contact with the first person diagnosed with Ebola in the U.S. could develop symptoms if they were infected. Meanwhile, officials worldwide are considering ways to combat the outbreak that is ravaging West Africa. CBS 4's Susan McGinnis reports from Washington.
Texas Ebola patient Thomas Eric Duncan continues to receive an experimental drug to try to help save his life. Duncan's on a ventilator at Texas Health Presbyterian Hospital and is getting kidney dialysis. Yesterday, Duncan's 19-year-old son, who hadn't seen him in 16 years, visited the hospital.
Thank you for all the support and just keep praying.
Health officials are monitoring about 50 people who had direct or indirect contact with Duncan after he fell ill late last month. The Centers for Disease Control and Prevention says infected people can show signs of the virus 8 to 10 days after exposure.
Each and every one of them is having their temperature monitored. As of today, none of them are sick, none of them has a fever. We'll continue to watch that very closely.
The White House says it will announce in the next couple of days new screening measures at airports to curb the spread of Ebola. Anxiety is growing over how prepared Western countries are to battle the virus. In Spain, 4 people are under quarantine after a nursing assistant became infected while treating a priest who died from Ebola. She is the first known person to have contracted the disease outside West Africa. Fellow nurses are protesting, calling for answers and the resignation of Spain's health minister. Susan McGinnis, CBS News, Washington.